Hi, I'm Anna Doty, curator of the Mütter Museum and director of the Mütter Research Institute, and welcome to Medical Quizzo. We'll be doing a few video-related questions throughout this event, so we hope you enjoy and good luck. How many hurdle skulls do we have on display at the Mütter Museum? Normally, there's some missing right now, but normally, how many do we have on display? What component of some tattoo ink can cause, on rare occasion, irritation while someone is in an MRI machine? And why? True or false? Your tattoo will be more visible after death during some part of your decomposition process. What layer of skin holds the ink of a healed tattoo? What was the most common secondary infection to the 1918-1919 influenza strain? What is the average weight of an adult human brain? This is our Chevalier Jackson collection of swallowed objects. You'll notice the light is off, and that's because, well, I don't know how to turn this light on either. But anyway, the question is, what is the most common item in our Chevalier Jackson collection? This is our megacolon. It's the largest human colon on display in the world, at least to our knowledge. Now, this results from something called Hirschsprung's disease, which is a congenital condition that causes chronic constipation. Now, what happens is the feces stays in the colon, and as it does so, it becomes drier and more compact and harder to expel. Now, this individual lived to be 29 years old, and at the time of death, it was recorded that he was only having one bowel movement per month. Now, the question is, at autopsy, how many pounds of fecal material were in his colon? Was it A, 25 pounds, B, 40 pounds, or C, 65 pounds? What Greek mythological figure is the alternate namesake for the first cervical vertebra, or the C1? In some cases, the practice of tight lacing or corseting can deform the rib cage. We actually have one on display in the museum. Now, along with that constriction of the rib cage can come a host of other conditions. So, which one is not a symptom of tight lacing or tight corseting? Is it difficulty breathing, visceroptosis, or the sinking or lowering of your internal organs, digestive issues such as constipation or flatulence, muscle atrophy, or gallstones? A bezoar or bezoar occurs when something gets trapped in the digestive tract of an animal or human, and it can be a variety of things, but the body compensates by forming a mineralization around it, like this. Now, the word bezoar comes from the Persian word for what? Is it hair, antidote, persimmon, or pearl? Welcome to the Benjamin Rush Medicinal Herb Garden, part of the College of Physicians in the Mütter Museum. It's named after Benjamin Rush, one of our founders and a signer of the Declaration of Independence. Now, we have lots of wonderful medicinal herbs here, and they're used for a variety of different functions, cures, what have you. Now, my question to you is, which of the following plants was used to increase sexual desire? Was it foxglove, lamb's ear, mandrake, or wormwood? Did you know that many diseases that we don't really associate with our skeletal system can still show up there or still affect it in some way, shape, or form? So, which of the following diseases or conditions does not show up in your skeletal system? Is it syphilis, smallpox, dysentery, scurvy, or maybe an iron deficiency like rickets or osteomalacia? Which is it? The first iron lung was used in 1928 at the Boston Children's Hospital. By 1939, approximately how many iron lungs were in use in the United States? Was it A, 500, B, 1,000, C, 1,500, or D, 5,000? Improved upon the original design of the iron lung and ultimately made it easier to access the patients by adding such things as a porthole and a bed that would slide in and out without the loss of air pressure? Was it A, Philip Drinker, B, Louis Agassiz Shaw, C, John Haven Emerson, or D, Philip Booth? Thank you for joining us in this round of Medical Quizzo. We hope you had a good time. I sure did. Now the winner will receive this lovely gift basket, which includes the book, some postcards, and some hypodermic Mütter pens. Basket not included. Stay tuned for the next round by the Vrolik Museum.
Welcome to Museum Vrolik, and thank you for joining us today for the Mütter Vrolik quiz. My name is Wieldreijer, and I am the educator, PR and event manager of the museum.
And I'm Laurens de Rooij, and I'm the curator director of Museum Vrolik. Let me first tell you a little bit about our museum. Museum Vrolik was founded by Gerard Vrolik and his son Willem, who were both anatomists here in Amsterdam in the 19th century. And they collected their material in their home, in a stately mansion at Amstel River. After they died, the collection became part of the University of Amsterdam and it was expanded by other anatomists.
Yes, we have over 2,000 objects here in the museum, and they're mainly wet and dry specimens and also wax models. Are these 2,000 objects the only things we're going to see today?
No, interesting enough, we will also go to the storage rooms downstairs in the building where we will see more of our collection because we have about 4/5 of our total collection is not on display.
Yeah, and that's actually pretty special that we're going to the storage rooms because normally they're not accessible to the public. What's so interesting about our collection to you?
What I found especially interesting, I would say, is that we not only have human anatomy and malformations on display, we are quite known for those parts of our collection, but we also have animal morphology, like the material that you see here. These animal anatomy preparations normally became, well, in other museums that is, they became part of different departments. So they went to a zoological museum instead of being together like we have.
Yeah, so actually it's quite rare that you have both a human and a zoological collection in one building. So I think we're going to start with the questions now.
Great.
So you wanted to talk about these dry specimens. Are these real hearts?
Yes, they're actually real hearts. They're injected with red and dark blue wax. And actually there was a technique that was developed in the 17th century by Amsterdam anatomist Frederik Ruys. And the technique was continued all the way up until the 19th century.
And is it possible to do this for any kind of organ or tissue? Or?
Well, only if it contains blood vessels. So Ruys would inject the blood vessels, but also, of course, tissue that contains cavities normally filled with blood, like these hearts, but also other possible structures.
Like placentas, for instance.
Or penises.
Yeah, so let's hear the first question. For question 1, it's possible that more than one answer is right. You can fill out your answer in the answer sheet, which can be found in the description box beneath this YouTube video. Please select all correct answers. The question is, why did anatomists use wax to inject specimens? Is it A, to preserve the specimen, B, to make it more lifelike, C, for educational purposes, to teach anatomy to students of medicine, or is it D, one needs less specialized skills to make a wax-injected specimen than one needs for a wet specimen? So since all of the people who brought our collections together were doctors, let's talk about being a doctor in the past. Because of course you wouldn't have a lab in order to diagnose people. You couldn't do any blood tests, for instance. So you had to rely on your bodily senses. For the next question, you're going to diagnose 3 different people by using your senses. The first person of question number 2 has handed his or her urine to you, and you're going to taste this. Wow, that urine tastes pretty sweet. So what disease or condition does patient number 1 have? The second patient has handed his diarrhea to you, and his diarrhea looks like rice water, so a bit like this. What disease does this person have? The third and last patient, you're going to smell him. Oh! And he has a fish body odor. He smells like fish. So what disease does the third person have? You wanted to talk about something else disgusting?
Yes, I want to tell you a little bit about this object here, the oldest object in our museum.
What is it?
It's a bladder stone. It's a stone taken out of the bladder of a person.
But that must be about the whole size of a bladder, right? I think it's about the size of my fist.
It's huge. It contained the full bladder, yeah.
Yeah, I think maybe you would rather go to the doctor in an earlier stage, right?
Yeah, but people would wait, of course, because they knew that the procedure of taking out such a stone was very painful. And of course, risk of infection. So it was very dangerous to do that.
And why does it have a metal casing?
The reason is that probably the surgeon was very proud of his work, not per se because the person survived, because he didn't survive.
Oh, we know that?
Yeah, we know, he didn't survive. But probably because it was so big, he was very proud of that. And he would hang the bladder stone in his workshop.
Okay. So our next question is, question number 3. What is the procedure to remove bladder stones called? And as a tip, you can use your ancient Greek. So are we looking at more bladder stones because they look quite similar?
No, there are actually no bladder stones. These are bezoar stones. Stones that come from the stomachs of antelopes or llamas.
So from the stomachs, you say, that what do they consist of then?
Mainly they made of hair or solidified masses of calcium.
And are they the same stones that J.K. Rowling writes about in Harry Potter?
Yeah, because they were sought for by kings because they believed they were functioning as antidote against all kinds of poisons.
Okay, so the next question is, question number 4. Against which kind of poison are bezoar stones probably effective? Is it A, cyanide, B, strychnine, C, arsenic, or D, they are not effective against poison? That's a myth.
So we're standing here in front of Hovius' cabinet. Hovius, whose portrait you see over here, was a physician in Amsterdam in the 18th century, and he collected bones with all kinds of pathologies. So his entire collection is in this cabinet, and you can see many cases of that.
Yeah, an interesting case is this one, the skull, and on the right side of the skull you see a small horn. This person had an osteoma, which was a benign tumor of the bone. And you can probably imagine if a man in the 18th century had a small horn on his head, that it was, well, he was probably a social outcast. You know, people would react in a very strange way if they saw a person like that, of course, and they would maybe even associate him with the devil.
And it's only just one of the interesting medical cases that we have here in this cabinet. One example of that is trepanation.
And question number 5 is about trepanation, which has been done for about 10,000 years probably. And the question is, what is trepanation exactly?
More than his father, Museum Vrolik was interested in congenital malformations, in birth defects. But not only in humans, but also in animals. So he collected quite a large number of animal preparations with malformations. Cases like that were this lamb with 2 bodies and 1 head, or the opposite, a skeleton of a lamb with 1 body and 2 heads. But also a little kitten with 2 heads, another one, and even a tiny little snake with 2 heads. Also, Vrolik collected cases of cyclopia. In this case, 2 lambs with only 1 eye. The next question will be about cyclopia.
Cyclopia is actually a spectrum with different variations of the same condition. So here we see a couple of examples. One fetus here, he has 2 eyes, but they stand very close together. And it's also possible to have 1 eye, but with 2 pupils. Fetuses with cyclopia are non-viable, so they are stillborn. And question 6 is also about that. The question is, what is wrong internally which makes fetuses with cyclopia non-viable?
Often people believe that our museum collection consists only or mainly of malformed individuals, malformed fetuses, but that's actually not the case. Most of our collection consists of normal human anatomical preparations that were created for students of medicine to understand the human body, like in this case here.
And this is also what question 7 is about. And the question is, what kind of structure is this? And by the way, it's not created by the makers of South Park. So we don't only have wet and dry specimens in the museum, but we also have a lot of wax models and plaster casts, like this one.
Yeah, this is a plaster cast of a malformation. Most of the casts that we have are of physical deformities, like this individual. And it's actually interesting because it's made by or commissioned by Museum Vrolik himself.
And why did he make a plaster cast out of this fetus?
Well, the reason is that, of course, in order to understand the malformation, he had to dissect it, he had to cut it open and see the inside. But by doing so, he would also destroy the outer appearance of the malformation.
Okay, so actually he wanted to document what it originally looked like.
Exactly.
Okay, so question 8 is, what is the diagnosis of this fetus? Is it A, conjoined twin? Is it B, an acardiac twin or trap sequence? Is it C, a fetus with Nager syndrome? Or is it D, a fetus with Appert syndrome?
Our museum collection is not only interesting for people who are studying medicine or who are interested in the history of medicine, but also for people who are focusing on the history of dentistry or are dentists themselves. Like you can see in this series of development of teeth from very young all the way to adult.
Yeah, what's interesting to me in this particular model is that it shows that even if you still have your deciduous teeth, the permanent teeth are already there in your jaw. Question 9 is also about this subject, and because the question is, how many teeth does a person normally grow during his lifetime? And that includes the deciduous teeth, the permanent teeth, and the wisdom teeth. Is that A, 32, B, 42, C, 52, or D, 62?
I really like the link with mythology and folklore that's in our collection. We already seen the examples of it in the bezoar stones, but also in cyclopic. Here, in this 19th century and early 20th century collection of tattoos that we have, we also see an example of it.
Yeah, an obvious link with mythology is the woman who is depicted in the tattoo which we see here. She is Lady Fortune, the Roman goddess of luck and fortune. She appears to be standing on a ball which is actually her wheel of fortune. And in her hand she holds a banner which indicates the direction of the wind.
So both luck, but also the direction of the wind were essential for the owner of this tattoo, namely a sailor. We will see in the next question another example of a nautical tattoo that has a mythological figure in it.
Yeah, so the question number 10 is, which goddess is tattooed on the skin of this sailor?
So we're now in the storage room of Museum Vrolik, actually one of the 3 storage rooms that we have. And besides, of course, many more human material that we have in storage, we also have a lot of animal preparations that you see here, but also more wax models, more plaster casts, and a lot of instruments and microscopic slides. So it's a large collection that we have stored in this space. In the background you see all these animal skulls and skeletons, and all of them, or at least most of them, came from the Amsterdam Zoo and were collected roughly between 1900 and 1930. The next question will also be about our animal collection, and we will look at these 2 skulls here. This is the skull of a toucan, and this is the skull of a hornbill. Question 11 will be, true or false, the toucan and the hornbill are closely related. We're standing in front of a cabinet filled with microscopic slides. Slides of the brains of all kinds of animals. Actually, it's only one cabinet of 7 that we have. And everything that's in here are brains collected by neuroanatomist in Amsterdam, Ariens Kappers, who collected them in the first half of the 20th century. He was specifically interested in the anatomy, comparative anatomy of animals. So that's why I'll show you one of these trays filled with 4 of these slides, in this case microscopic slides of the brain of a chimpanzee.
So in the 19th century there were several inventions that made meticulous research, like we just saw examples of, possible. And this tool is invented specifically for that purpose of making those meticulous slides. And question number 12 is, what is this tool called, used to make wafer-thin slices of tissue possible?
So we're here in the wet specimens room, one of the other storage rooms of our collection. And what we see here are, of course, all kinds of wet specimens. And most of them, at least the ones you see here, are all from the original Vrolik collection, so collected in the 19th century. Some of them are comparative anatomical, so there are all kinds of animals that you see, but in other cases you see preparations with all kinds of diseases, pathological anatomy.
So we'd like to show you a couple of conjoined twins from our collection. This one particularly is a favorite of mine, these monkeys. Conjoined twins are classified by the point at which their bodies are joined. So the 3 examples we see over here, the kittens and the guinea pigs and the piglets, are all from the same type. This type you see over here is called cephalothoracopagus. And the question is, what does that translate to?
Liquid specimens take constant care. For instance, you see that the liquid level drops because the liquid evaporates. In this case, that's happening with this nose of a tapir. Or you see that the liquid becomes darkened because substances from the preparation dissolve in the liquid. And that's why we have in our team a liquid specimens restorer. And she's here with us, Inge Dijkman.
Hello, and I have a question for you. This frog is partially translucent. What fluid makes it that way? Is that A, glycerin, B, formalin, C, methyl benzoate, or D, alcohol?
So we're already at the last question, and we came up with tons of questions that we didn't get to use. So we'd love to know what you thought about the quiz and if you'd like more events like these. Our last question is about this particular specimen. It's of the lower spine, or the lower vertebra. And as you can see, that this person had a disease that is very rough on the bones. Question 15 is, what is that disease? Is it A, FOP, B, cholera, C, rickets, or D, tuberculosis? So thank you very much for joining us here today. I hope you've had a good time and you've enjoyed exploring a teeny tiny part of our collection. And don't forget that if you've done a good job, that you'll be able to win both a Museum Vrolik but also a Mütter Museum goodie bag. And for our goodie bag, you'll be able to win a tote bag, Museum Vrolik tote bag, and also a skeleton magnet, a wet specimen postcard, a Siamese twin notebook, a floating jaguar pen, and also our museum catalog, which is called Forces of Form, so it's also in English. And if you'd like to know more about our collection, please feel free to follow us on both Facebook and Instagram. Just search for Museum Vrolik. Of course, you're also very welcome to visit us in Amsterdam once we reopen. So thank you very much.